No one's talking about embarrassing symptoms of perimenopause and menopause. Things like sneezing and then you leak, body odor changes, the labia shrinking. You deserve to know what is happening to your body in perimenopause. And I want to break that stigma today. And we are going to talk about it in this video. What are the unusual, embarrassing symptoms of perimenopause that no one's talking about? I'm Dr. Jen. Welcome to my channel. I help perimenopause and menopause women every single day in my medical practice, help to thrive right now and in the future. So this video is about embarrassing symptoms of perimenopause and menopause. And I'm doing this video because this is what happened to me. I noticed, man, what is up with this change in my body odor? Like, why is this happening? This has never happened before. Or why am I having urgency symptoms? And so I think it's important to educate and empower you so you know what is happening to your body, especially down there, which isn't talked about very often. And you can go to your provider with questions and concerns if you need help. So let's talk about the top 5 embarrassing symptoms of menopause. Number 1, dry vagina. Yep, this term has been used. It feels like a cactus. It feels like a desert. It feels like burning. Women describe it a lot of different ways. It can be dry just sitting and not even really doing anything, and certainly can be more dry and irritated if you're doing things like going to the beach or having sex. And the dryness happens because when you lose estrogen makes the tissue down there very plump, able to tolerate friction during sex, able to make lubrication. And so when you lose estrogen, your ability to make lubrication goes down, your ability to have the tissue have some resilience and be thick and tolerate more friction goes down, and the tissue becomes really thin and pale and real irritable. So things like sex can be very painful. In fact, women will often describe it's uncomfortable even having him put anything in there. And when they're having sex, they experience terrible burning and irritation. So vaginal dryness is one of those very common symptoms. In fact, 60% of women experience vaginal dryness, and there are solutions. So for vaginal dryness, obviously estrogen is amazing. Vaginal estrogen, I think every adult menopausal vagina needs estrogen. And estrogen, again, helps improve collagen, improve the tissue, make it pink and have good blood flow, improve lubrication. So that's something that's critically important when you're in that stage. The other options are things like hyaluronic acid, where it helps retain moisture. So you would use things like vitamin E and put moisture in the vagina and then retain moisture. And there are suppositories that are offered online by certain companies that do offer that, and it can be compounded with estradiol and making a suppository that has estradiol, hyaluronic acid, vitamin E, so give you moisture, retain moisture, and fix the tissue. So those are some options. And then there are obviously some non-hormonal options too that people use for moisture. There are products that, Ectoin, which also helps with an ingredient that helps with moisture in the vagina. But it's important that you recognize that if you're having vaginal dryness, there are options for you. Number 2, painful sex, because it kind of piggybacks off of this. Painful sex can happen not only because of the dryness issue, but also women can notice this because the tissue now is changed, right? So the anatomy can be different. And also the fact that the pelvic floor muscles can start to relax. And so some women notice that they get pain in certain positions, or they may get pain essentially even doing exercises like physical activity that causes them pain because of pelvic floor dysfunction. So as we age, we have relaxation of our muscles, but we also have relaxation of the tissue, which can ultimately lead to painful sex. So a good exam by a good doctor who understands pelvic anatomy is crucial to try to figure out, is this pelvic floor dysfunction? And can you go to pelvic floor PT, which is amazing. To be honest, I think everybody should do it in their 40s, like a proactive treatment to help make sure your pelvic health is good. And there are lots of people that do wonderful videos on pelvic floor therapy, so I won't dive into that. But definitely if this is you, I would look into pelvic floor therapy. Number 3, body odor changes. Like suddenly things smell funky. Like what is going on? Why are you having sweating in your armpits you may not have had? Why are you having BO even in the vulvar tissue and the hair? I mean, things can change from a body odor standpoint. The microbiome on your skin, and a microbiome is the bacteria that's on the skin. The microbiome changes, and that microbiome in the vagina changes, in the bladder, on the skin, in the mouth, in the gut. This changes when you lose hormones. And so people start noticing that their odor changes. It can also change due to, say, testosterone levels, because testosterone levels could be still somewhat normal, and someone can have a low estrogen and low progesterone. And then so they're noticing more effects from testosterone. So body odor changes, and that sometimes requires you to change products that kind of agree with your chemistry a little bit more. Sometimes that ends up leading to hormone replacement therapy that can specifically kind of get the hormone balance back into gear. And sometimes it even leads to non-hormonal options that can help specifically with body odor by changing the microbiome. Okay, number 4, surprising or embarrassing symptom is one that's been on Instagram and YouTube lately. Your labia shrinking. Yep, your labia don't disappear, although they can get pretty darn small, but literally shrinking and becoming smaller. So when you were in puberty, you had labia minora that were very, very small, and they kind of expanded and got larger due to the surging hormones. Well, the opposite thing happens when you go through menopause. The labia start shrinking, becoming thinner, becoming paler, becoming smaller, and you look anatomically different, right? You look in the mirror, if you take a mirror down there, which I highly suggest women to do so they know what their anatomy looks like normally, it may look like the labia are actually getting smaller, or even more wrinkles, or even less plump. And that's because A, they're losing collagen, but B, with the lack of hormones, the tissue tends to shrink. And women often will think, why do I look so different? I mean, why are these changes happening? And sometimes that affects libido. If you notice that you don't look the same as you did before, it can sometimes make you self-conscious, especially with your partner, right? And so understanding that that's normal, that they tend to shrink and get smaller, is okay and acceptable. Lastly, I would say stress incontinence, urgency symptoms. So bladder symptoms. I said a little bit about the microbiome in the bladder, but basically the microbiome changes when you lose estrogen. And so because of that, you're more susceptible to infection. So women get more UTIs in menopause. Even recurrent UTIs, because they don't have that nice bacterial composition to prevent UTIs. But the other thing is that they develop urgency symptoms, because the muscle also likes to have estrogen to work properly. So the muscle under the bladder that helps control when you're going to cough, and then your muscle squeezes and says it's not the time to leak, that muscle becomes relaxed. And also it doesn't necessarily contract appropriately. So some women get urgency symptoms where the muscle is actually contracting and making them feel like they have to pee, even though they may not get much out. So those symptoms can be pretty embarrassing if you're like at the mall walking around and suddenly you start having leaking, or you just gotta go right now, like the commercial is about like 10 years ago. And it's frustrating because you have to change kind of what you do on a day-to-day life. So those are the 5 embarrassing symptoms that happen in menopause down there, but these are things that you can actually do something about. And I would encourage you to talk to your provider if you're experiencing any of these about what are the options specifically for you. And you don't have to live with this. You don't have to suffer. You can get options to help you. I hope this video was awesome. Please like and subscribe. Please send this information to your friends, your sister, right? Those people you feel comfortable talking about these things, because the more that we debunk these myths about perimenopause, menopause, the better it is for every single woman.